Step 2, approach and identify and prepare a patient phlebotomy class. Approaching the patient. Being organized and efficient plays a role in a positive and productive collection experience. Before collecting the specimens, the phlebotomist should arrange the requisitions according to priority and review them to see that needed equipment is on the blood collecting tray or cart before processing to the patient's room. Outpatients are typically summoned into the drawing area from the waiting room in order of arrival and check-ins. Looking for signs, page 213. Looking for signs containing information concerning the patient is extremely important part of the approach to inpatient. Signs are typically posted on the door to the patient's room or on the wall beside their bed or behind the head of the patient's bed. Of particular importance to phlebotomists are signs indicating that the infection control precautions are to be followed on entering the room and signs that prohibit the taking of blood pressures or blood draws from a particular arm. Other commonly encountered signs may identify limits to the number of visitors allowed in the room at one time or indicate that the fall precautions are to be observed for the patient or warn that the patient has a severe allergy. Example is latex or flowers. A sign with the letters DNR or DNAR is do not resuscitate and do not attempt resuscitation, which means there is an order called a no-code order, stating that the patient should not be revived if he or she stops breathing. Pictures are sometimes used in place of written warnings. For example, a sign with a picture of fall leaves is sometimes used to indicate that the patient is at risk for falling. It is sometimes used as a picture of a fallen leaf also shows a teardrop on it, which sometimes used to represent an obstructed wards to indicate that a patient has lost a baby. Entering a patient's room. Doors to patient's room are usually open. If the door is closed, knock lightly, open the door slowly, and say something like "good morning" before proceeding into the room. Even if the door is open, it is a good idea to knock lightly to make occupants aware that they are about to enter. Curtains are often pulled closed and nurses are working with patients or when patients are using bedpans or urinals. Make your presence known before proceeding or opening the curtains so as to protect the patient's privacy and avoid any type of embarrassment. Physicians and clergy. If a physician or member of the clergy is with the patient, please do not interrupt. The patient's time with these individuals is private and is very limited. If the draw is not a step, procedure, timed, or urgent priority, go draw on another patient and check back after that. If that is the only patient, waiting outside the room for a few minutes, or go back to the lab and draw the specimen on the next sweep. Family and visitors. Often there are family members or visitors with the patient. It is best to ask them to step outside the room until you are finished. Most will prefer to do so. However, some family members will insist on staying in the room. It is generally acceptable to let a willing family member help steady the arm or hold pressure over the site while you label tubes. Unavailable patient. If the patient cannot be located, is unavailable, or are unable to obtain the specimen for any other reason, it is policy of most style laboratories that you fill out a form stating that you were unable to obtain the specimen at the requested time and the reason why. The original copy of this form is the original copy of this form is left at the nurse's station and a copy goes to the lab. Identifying yourself. Identify yourself to the patient by stating your name, your title, and the reason you are there. For example, good morning, I am Joe Smith from the lab. I'm here to collect a blood specimen if that is all right with you. If you are a student, let the patient know this and ask permission to do the blood draw. This is part of an informed consent and patient's rights. The patient has a right to refuse to have blood drawn by a student or anyone else. Obtaining consent. The patient's consent must be obtained before starting the venipuncture. Always ask a patient for permission to collect the specimen. This is not only courteous, but it is also a legal required. Consent does not always have to be stated verbally. However, it can be implied by actions. For example, if the patient extends the arm when you explain why you are there, or a phlebotomist must never collect a blood specimen without permission or against a patient's will. Objections should be reported to the appropriate personnel. Bedside manner. The behavior of a healthcare provider toward or as perceived by a patient is called bedside manner. Approaching a patient is more than simply calling out a patient into the blood drawing room or finding an inpatient's room and proceeding to collect the specimen. The manner in which you approach and interact with the patient sets the stage for whether or not the patient perceives you as a professional. Gaining the patient's trust and confidence and putting the patient at ease are important aspects of a successful encounter and an important part of a professional bedside manner. Patient identification, patient ID. Patient ID is the process of verifying a patient's identity. It is the most important step in specimen collection. Obtaining a specimen from the wrong patient can have serious, even fatal consequences, especially specimens for type and cross-match prior to blood transfusions. Misidentifying a patient or specimen can be grounds for dismissal of the person responsible and can even lead to a malpractice lawsuit against the person. Verifying name and date of birth. Page 216. The patient must be actively involved in the identification process. When identifying a patient, ask the patient to state his or her full name and the date of birth. In addition, the CLSI guideline, Accuracy in Patient and Sample Identification, recommends having the patient spell their last name. This also serves as a memory jogger to help the phlebotomist remember that the patient's ID was verified. Any errors or differences must be resolved before a sample is collected. Checking identification bracelets. If the patient's response matches the information on the requisition, proceed to check the patient's ID band or bracelet, also called an armband or wristband, if applicable. Inpatients are normally required to wear an ID band, usually on the wrist, and this typical ID band lists the patient's name and hospital identification number or medical record number, what we refer to as the MR number. Additional information includes the patient's birth date of age, room number, and bed designation, and physician's name. The patient's name, MR number, and date of birth or age on the ID number must match the information on the requisition exactly. Identification protocol may vary slightly from one healthcare institution to another. Generally, ID information such as room number, bed number, and the physician name are allowed to differ. For instance, occasionally a room number will differ because a patient has been moved. The name of the ordering physician may be different since it is not unusual for a patient to be under the care of several different physicians at the same time. Three-way ID. To avoid identification and mislabeling errors, some inpatient facilities require what is referred to as a three-way ID, in which the patient is identified by three means. The first is the patient's verbal ID statement, a check of the ID band, and a visual comparison of the labeled specimen with the patient's ID band before leaving the bedside. Some facilities are also now showing the labeled specimen to the patient and asking for verification that the correct name is on the label. ID discrepancies. If there is a discrepancy between the name, MR number, or date of birth and the ID band and the information on the requisition form, the patient's nurse should be notified. The specimen must not be obtained until this discrepancy is addressed and the patient's identity has been verified. Missing ID. If there is no ID band on either of an inpatient's wrist, ask the patient if you can check to see if it is on the ankle. Intravenous IV lines in patients' arms often infiltrate the surrounding tissues and cause swelling, which necessitates removal of the ID band. When this occurs, especially on a patient with IV lines in both arms, nursing personnel sometimes place the ID band around an ankle. An ID band on an IV pole or a night table could belong to a patient who previously occupied that bed and should not be used for identification purposes. It is not unusual for a new patient to occupy a bed before the nursing staff has had a chance to attach his or her ID band. ID by the patient and confirmation of ID by a nurse or relative with documentation of that person's name. If an ID band is required and the patient is not wearing one, it is usually acceptable to ask patient's nurse to attach an ID band before collecting the specimen. Some sites require the phlebotomist to refrain from collecting the specimen and fill out a special form stating that the specimen was not collected because the patient did not have an ID band. In rare emergency situations in which there is no time to wait for the attachment of an ID band, the patient's nurse is allowed to verify the patient's ID. In such cases, the nurse must sign or initial the requisition. Follow institution protocol. Sleeping patients. Obviously, proper identification and informed consent cannot occur if the patient is asleep. If you encounter a sleeping patient, as often the case in hospitals and nursing homes, wake the person gently. Try not to startle the patient, as this can affect test results. Speak softly but distinctly. If the room is darkened, avoid turning on any bright overhead lighting, at least until the patient's eyes have adjusted to being open, and warn the patient first. Unconscious patients. Unconscious patients are often encountered in emergency room and intensive care units. Ask the relative or the patient's nurse or physician to identify the patient and record the name of that person. Speak to the patient as you would to someone who is alert. Identify yourself and inform the patient of your intent. Unconscious patients can often hear what is going on around them, even though they are unresponsive. Emergency room ID procedures. It is not uncommon for an emergency room or emergency room department to receive an unconscious patient with no identification. Clear guidelines for this situation provided by the American Association of Blood Banks include the following as listed below in the bullets. Assign a temporary number to the patient and record it on the test request forms. Fill out labels by hand or computer and apply them to the test request and specimens after collection. When a permanent number is issued, it must be cross-referenced to the temporary number. And attach an ID band or device to the patient that has a name and temporary number on it. In many institutions, the phlebotomist is allowed to attach a special 3-part identification band, such as a Tipanex blood recipient ID band, to an unidentified ER patient's wrist. All 3 parts contain the same number. The first part begins with the patient's ID band. The second part is attached to the specimen. And the third part is used if the patient needs a transfusion, and it is attached to the unit of blood. Please follow your institution's protocol for unidentified patients. Identification of young, mentally incompetent, or non-English speaking patients. If the patient is young, mentally incompetent, or non-English speaking, ask the patient's nurse, attendant, relative, or friend to identify the patient by name, address, and identification number or birth date. This information must match the information on the test requisition and the patient's ID band if applicable. Neonates and other infants. ID bands may be placed on the lower leg instead of the arm of an impatient newborn or babies under 2 years of age. In some facilities, newborns may also have another ID with their mother's information. In addition, there's usually a card on the isolate with the baby's information on it. It can be used to locate the infant. However, it must not be used for final identification purposes. The child may be identified by a nurse, relative, or guardian. The name and relationship of a relative or guardian, or the name and title of a nurse who identifies the child, should be recorded on the requisition. Information that must be confirmed on the babies includes the following listed below in bullets: the name, gender, medical record number, and mother's last name and name of person provided at registration. Outpatient ID. Typically, the outpatient collection site receptionist verifies the patient's identity and fills out the proper lab requisition forms to physicians who use their services. So some outpatients arrive at the collection site with lab requisitions that are already filled out. Information must still be verified, and the patients may be required to show proof of identification, such as a driver's license or a picture ID. Outpatients do not normally have ID bands. However, they may have a clinic-issued ID that contains their name and other information identifying them as clinic patients. Always ask an outpatient to state his or her name and date of birth and spell the last name. Make certain that the patient's response matches the requisition information before obtaining the specimen. Explaining the procedure. Preparing the patient, page 219. Most patients have a blood test before. A statement of your intent to collect a specimen for a blood test is usually sufficient for them to understand what is about to occur. A patient who has never had a blood test may require more detailed explanation. If a patient does not speak or understand English, you may have to use sign language or other nonverbal means to demonstrate what is about to occur. Addressing patients' inquiries. Some healthcare facilities will allow the phlebotomist to tell the patient the name of the test or test to be performed. Others prefer that all inquiries be directed to the patient's physician. Never attempt to explain the purpose of this test to a patient. Handle such inquiries by stating that it is best to have the doctor or nurse explain the test to them. When bedside testing is being performed, the patient is often aware of the type of test being performed and may ask about results. Handling patients' objections. Although most patients understand that blood tests are needed in the course of treatment, occasionally a patient will object to the procedure wanting to be done. Outpatients rarely object because typically they have been personally directed by their physician to obtain testing, and in most cases have been given a test requisition form already. Inpatients, on the other hand, may not be aware of all the tests that have been ordered or the frequency with which some tests may be repeated. Some may have difficult veins and just get tired of the ordeal. Just remind them that the doctor ordered the test and needs the results to provide proper care. Will sometimes convince the patient to cooperate. Depending upon institution policy, you may be required to fill out a special form stating why you were unable to collect the specimen if you ever in a situation where there is a patient continues to refuse. Please document and why it happened and report to the nurse. Handling difficult patients. The patients may echo your cheerful, pleasant manner. Hospitalization or illness is typically a stressful situation. The patient may be lonely, scared, or fearful, or just plain disagreeable. It is important to remain calm and professional and treat the patient in a caring manner under all circumstances. Cognitively impaired or combative patients. Some patients may display unpredictable or sudden movements and behaviors that could pose a danger to themselves, the phlebotomist, or others nearby. If a patient exhibits such behaviors, it is essential for an additional person or employee to be enlisted to assist if necessary. Also be mindful of where you place equipment, being certain to keep it out of reach of the patient. As with venipuncture on any patient, always have a gauze pass ready and be prepared to release the tourniquet quickly in case the patient pulls the needle out or certainly jerks, causing the needle to come out or to go deep into the arm. Should the needle penetrate deep into the arm, the patient's nurse or healthcare provider must be informed and the incident documented according to facility policy. Patients in altered mental states. An altered mental state, also called altered state of consciousness or state of mind, is a state that is significantly different from the normal waking state of a conscious person. Examples of patients who may undergo a change in mental status include transplantations, patients with liver failure, and those suffering from post-traumatic stress syndrome. Alcohol abuse, illegal drugs, marijuana, and even prescription drugs can also be associated with mental problems in patients. Such conditions can cause problems with blood collection, including verifying patient identification, obtaining informed consent for procedures, and trying to safely obtain specimen if the patient is combative or unaware of what is happening. Assistance with patients who are in an altered state of consciousness is required for the safety of everyone involved and others nearby. Addressing needle phobia. An admission of needle phobia, intense fear of needles by a patient or signs that suggest it, such as extreme fear or apprehensive in advance of venipuncture, should not be taken lightly. Needle-phobic individuals typically have a heightened sensitivity to pain and can experience a shock-type reaction during and immediately following venipuncture. Symptoms include paleness, profuse sweating, lightheadedness, nausea, and fainting. In severe cases, patients have been known to suffer arrhythmia and even cardiac arrest. Needle phobia is estimated to affect more than 10% of the population to such a degree that they avoid medical care. It is important to those who do not have the courage to submit to blood tests and are treated with empathy and special attention, and that steps to be taken to minimize any trauma. Basic steps that can be taken include the following listed below in bullets. Have only the most experienced and skilled phlebotomist perform the venipuncture. Have the patient lie down during the procedure with legs elevated, and apply an ice pack to the site for 10 to 15 minutes to numb it before venipuncture. It is recommended that anyone who has suffered a severe reaction as a result of needle phobia have future procedures involving needles performed at sites where personnel are trained in CPR and a defibrillator is readily accessible. Addressing objects in the patient's mouth. Do not allow a patient to eat, drink, chew gum, or have a thermometer, toothpick, or any other foreign object in the mouth during blood collection. Objects in the mouth can cause choking. A bite reflex could break a thermometer and injure a patient. Politely ask patients to stop eating or drinking and remove objects from their mouths until you are finished with the venipuncture.